Good morning, members, and thank you. We have a quorum and I call the meeting to order. I'd like to welcome all the members who are participating by video conferencing and to remind members about the protocols regarding the use of electronic devices. So, no apologies have been received in advance of the meeting to the committee office. I'll just check with the clerk. Have we?
No other apologies,
no
Chair.
Other apologies. Okay, members. So we're then going to move into our first substantive session today, and the first session is a joint meeting with the Disabled People's Parliament and a briefing from the Department of Health. So, members, this is the first joint meeting of the Committee and the Disabled People's Parliament, and I would like to welcome those delegates from the Parliament with us in the chamber. It's, I feel, a very important, a very historic day, but also a very natural day in a sense of the terms of how this committee have operated since the outset. From the outset, we stated that we would want to be a very inclusive committee, a committee that reached out to people who have solutions, have knowledge of their particular area and expertise, and we wanted to access that expertise and to ensure that that expertise was part of the discussion around health. So we are delighted to have your expertise and your experience with us today. We're delighted that the Department have facilitated a panel of officials to take questions from you, and we are delighted that the Minister is here today to present and to take a few questions as well. So it's the outworking of, and I'm particularly delighted, I have to say, the very first APG that I attended here when I became an MLA was the APG for disability, or the APG for disabled people, and actually 3 of the 5 people who are here today, Michaela, David and Amanda, I think we're all at that meeting. So I think it's a nice way to sort of, towards the end of the mandate, to see this event taking place today and to see the important work that we are hopefully going to achieve here today being completed in that sense. So thank you for that. So I'm going to first of all introduce the members that we have with us from the Disabled People's Parliament. We have Amanda Paul, David MacDonald. On Starleaf, we have participating Joanne Sampson, June Best and Michaela Hollywood. So at the special session of the committee, we will be getting briefed by the Minister of Health, and officials are available to answer any questions. We are also delighted today, and I think it's a very important and a significant moment, is the meeting will be signed by British Sign Language signers. Unfortunately, we weren't able today to get availability to have Irish Sign Language possible during the meeting live, but we will endeavour to get an Irish Sign Language interpretation signed version done as soon as possible, and we will put that out publicly as well for people who use Irish Sign Language. So I would now like to go ahead and welcome the Minister and his officials from the Department. So first of all, Mr Robin Swan, MLA, Minister of Health. Robin, can you hear us there okay?
I can, Chair, yes, thank you.
Thank you. Gearóid Cassidy, Director of Primary Care in the Department. Gearóid and Will too, can you hear us okay? So we're not hearing you there, Gearóid. Just, I'm not sure if you can check your sound. I'll move on and we'll come back to you. Hopefully when we come back to you, we will be able to hear you okay. Mark McGuckin then, Director of Disability and Older People. Are you able to hear us okay, Mark?
Good morning, Chair. I can, yep.
Thank you, and we're seeing and hearing you, Mark. Thank you. Colin Dunlop, Head of Physical, Sensory and Disability. Colin, can you hear us okay? Okay, I'm not seeing or hearing Colin. I'm going to move on, and we'll come back to you, Colin. Hopefully we'll be able to hear you when we come back. Jim McComish, Deputy Principal, Physical, Sensory and Disability Unit. Jim, can you hear us?
Chair, I think some of my team are having difficulty getting on, so maybe if we could just introduce them as they get on if we need to.
Yep, okay. And we will then also be hearing from Jerome Dawson, are certainly available to take questions, and Jerome is Head of the Learning Disability Unit, and Andrew Webb is Head of Elderly and Community Care Unit. So I'll go, and we're also joined by Ryan Wilson, who's a Director in Secondary Care. So I will then go ahead back to yourself, Minister, and ask you to go ahead and brief the meeting this morning, please. Thank you.
Thanks, Chair, and look, thank you for the opportunity to join with your joint meeting this morning with those members of the Health Committee and also the representatives from the Disabled People's Parliament. I'm very pleased to be invited here today to deliver a few opening remarks, but unfortunately due to other pressures I'm unable to be with you in person or to stay for the full session. But I've made a wide range of my officials available today who will be able to continue the engagement with both representatives of the Disabled People's Parliament and the Health Committee. And I commend your committee chair for facilitating the attendance of members of the Disabled People's Parliament here today. I think this joint event actually underscores and acknowledges the very important role of the Disabled People's Parliament and what it has in representing the views of people with lived experience of disability. Actually focusing on the person first and their condition or disability second, and actually furthering the rights of disabled people in Northern Ireland. And I wish I was with you yesterday, Chair, when you updated, or sorry, I was with you yesterday, Chair, when you updated the speaker in regard to today's event as a follow-on from the previous meeting that he'd actually hosted. I understand and fully and place great value on the benefits of co-production and co-design of services, actually working closely with people living with a disability. So for example, in late 2021, my department established a regional disabled people's forum for health and social care, which is bringing the views of disabled people, carers, the statutory sector and the voluntary and community sectors actually closer to government. And it's that forum that provides feedback at a strategic level to my department on current, new and emerging policy initiatives, which contributes to improving the experience and outcomes of people living with a disability in Northern Ireland. But due to the pandemic, the last few years... Sorry, Chair, I'm starting to get feedback.
Okay, there's no feedback in the room, so
okay.
Yeah, you're still clear to us.
Okay,
Minister,
no,
yeah.
that's all right, Chair. So due to the pandemic, the last few years have been extremely challenging for all of us, and in particular the most vulnerable members of our society. Children, the elderly and disabled people, including those who were clinically vulnerable, have endured significant personal challenges as they actually strived to live their lives safely throughout the pandemic. And my department and the health service have sought innovative solutions to the challenges of delivering our services with primary, secondary and social care in as safe a manner as possible during the pandemic. And I want to acknowledge fully the importance of making all our health and social care services, and that includes primary care services, accessible to disabled people. And I understand that whether primary care services are delivered remotely or face-to-face, it's very important that we take the necessary steps actually to enable them and enable every patient to be able to access them. So for disabled patients, this may mean ensuring that our primary care services are able to make use of appropriate support services and technologies. So looking to the future, it's crucial that we work together to ensure primary care services are able to deliver high quality, accessible services for everyone in Northern Ireland. And in order to address the longer term pressures of increasing demand for primary care services, my department has been continuing to invest in our GP workforce. We've increased the number of GP trainees by over 70% since those 2015 levels. And work has also recently commenced on a review of GP trainee places to make sure there are enough GPs to meet our primary care needs into the future. So everyone here today is aware of the key role played also by our domiciliary care workforce in helping to enable people to live independently in the community. But demand continues to outstrip supply, and providers have been experiencing difficulties with staff retention and recruitment, and of course the recent progression of Omicron cases still means that a number of staff are off sick or isolating. But there's no doubt that the number of people awaiting access to suitable care arrangements is still too high. So in recognition of those pressures faced by the sector, I announced a funding support package of up to £23 million in November, and that was for the independent domiciliary care and wider social care sector, and that was with the aim of facilitating increased capacity across this sector. The aim of that funding was to enable employers to offer improved terms and conditions, training and career progression opportunities, and rates of pay, which should assist in addressing some of the immediate issues. And it is hoped that this will provide an incentive to those wanting to stay within the sector and indeed actually attract new staff to the sector with the aim of increasing capacity. The additional funding has already been utilised by employers to offer enhanced rates of pay and better terms and conditions. And it's that funding package that is currently being rolled out. It does not extend to personal assistants employed through direct payments. However, I am considering if there would be scope to address the position of personal assistants, who are extremely important as part of our care system, because I recognise that the way things have been done up until now is no longer fit for purpose. And a new approach is very much overdue, both in terms of how we deliver domiciliary care, but also how adult social care as a whole is delivered. And it's on that basis £800,000 was allocated to the Health and Social Care Board for 2021. And that was in order to test pilots and new ways of service delivery as part of our wider reform of adult social care. The majority of the funding was provided to the South Eastern Trust to support the rollout of their new pilot for a new model of domiciliary care. And the South Eastern Trust model could potentially be adopted as a template or model for the region, depending on the outcome of that pilot. It moves away from a time for task model towards an outcomes model, whereby people get access to a more flexible service. So the work of the reform of adult social care will actually inform the long-term reform of the sector, and that includes domiciliary care as well. And as you know, Chair, a public consultation on the reform of adult social care was launched on the 26th of January. And that public consultation sets out our proposals for reforming adult care and support and making significant system change. Also, Chair, something that you've continued to push and ask questions on is that of adult care, short breaks and health and social care transport, because we know they were among the essential services that have been greatly impacted by the pandemic. And it's fully understandable that many people have been calling for the full reinstatement of these services. But it should be equally recognised, however, that these services are subject to nationally agreed health protection guidance designed to keep service users safe. And as community transmission of COVID-19 still remains high, there are high rates of staff absences, and that results in the temporary reduction or closure of adult daycare and short breaks to respond to pressures in acute services and supported living. But again, my department is liaising with Trust to ensure that the pressures are addressed and placement breakdown is avoided. So while there have been significant advances in how we live with the virus, remobilisation of services presents increased risk in terms of COVID-19 transmission. It's not possible to fully quantify the COVID-19 risk to increase respite services. Each service user and setting presents a varied level of risk. However, it's recognised that partial service delivery is impacting the physical and mental health of vulnerable adults and carers. That's why I approved the pathway for remobilisation of adult daycare, short breaks and transport back on Monday the 31st of January. And my officials working with the Health and Social Care Trusts have been with them to direct full implementation of that pathway. And trusts will be required to actually outline the time frame to fully restore daycare, short breaks and transport. The review and pathway will be published on my department's website, and the formal review of the implementation of the pathway will be undertaken within 3 months of inception. So, Chair, moving on to our COVID-19 vaccination programme, which follows the advice and recommendations of the Joint Committee on Vaccination and Immunisation. All vaccine clinics should be capable of accommodating anyone with a disability. All our leaflets and materials are available via the PHA website and can be viewed in larger print or using JCVI. JCVI will continue its rolling review of our vaccination programme and that epidemiological situation, particularly in relation to the timing and value of doses for those considered to be at lower risk, and we intend doing that ahead of autumn 2022. Safe and Equitable access to hospital services is of course of vital importance to disabled people in particular. And the Belfast Trust has had a proactive disability steering group, actually since 2008. And that comprises a broad range of trust staff, disability representative organisations and disabled people. This has helped us to work in partnership to bring forward innovative and inclusive initiatives to improve the experience and promote independence of service users, patients and staff with a disability. And this has really just been a brief overview of the work to date within the health service and beyond, as we endeavour to make our health and social care services as safely accessible as possible to our people with disabilities. Plainly, Len, a lot of work has been done, and there's still plenty more to do. So once again, I would like to extend my appreciation, Chair, to everyone here today who is engaged with my department and the wider health service in that spirit of co-production. And as Chair has pointed out, I'll hand over to my official, Mark McGuckin, who's our Director of Disability and Older People, who will respond, I think, more fully to questions that members of the Disabled People's Parliament have already shared with us. And as you indicated and introduced, there's a wide range of officials here today, and they, of course, will be happy to take questions from committee members as well. Chair, I hope that you've had I hope you will have a constructive conversation today, and I thank you for that. But Chair, as I spoke to you this morning, I'm content to stay for a few minutes and take questions if that's helpful for you and the Disabled People's Parliament at this stage.
Okay, thank you, Minister. Thank you for that briefing, and thank you for taking. So, in light of that, what I will propose then, I'll just go directly to the delegates from the Disabled People's Parliament, and I have an order list here, so I'll go to those in order. We'll get a couple in, and you can indicate, Minister, at what point you're handing over to Mark. But I'll go first of all to David then. David, go ahead, please.
Thank you very much. Minister, welcome. Good to see you again. I want to address the issue of the Independent Living Fund. It was good to hear you talking about the value of personal assistance, because especially in these times, personal assistance keep me safe. And I'm just wondering where we're at with the Independent Living Fund. As you know, financially, legally, socially and collectively, the Independent Living Fund works. Financially, it gives a startling social value return of £10.89 for every £1 invested. Legally, it accords with Articles 10 and 19 of the United Nations Convention on the Rights of People with Disabilities. That's the right to quality of life and the right to independent living. Socially, it affords the most disabled people in this country freedom to choose and control our own lives, freedom to determine and decide what to do, when, where, how to do it, and with whom. Freedom to live a life worth living. Collectively, current stakeholders, future stakeholders, organisations of and for disabled people, and all the trusts agree to it. No. Will you commit to reopening the Independent Living Fund to new applicants by the end of this mandate?
Minister.
Thanks, David. I had difficulty picking up some of that, Chair, unfortunately, but having engaged with David on many occasions, I know fully the point that he'll be making in regards to the value of the Independent Living Fund and the support it brings to people with disabilities, but also how he has advocated greatly for it, not just during my time as Minister, but also in the engagements that he'd had with Richard Pengelly as Permanent Secretary prior to the restoration of the executive back in January 2020. In regards to being able to do anything in the remainder of this mandate, David, I cannot give you that commitment, and you've known me well enough that I've never made a promise that I'll not stand over. But we do, in the department, value what it has done and what it has been able to do. I only wish I was in a position where today that we could be looking to a 3-year budget for the new executive, and any successor in this place after the next election could be making those commitments with the guarantee of an increased budget but also the surety of a 3-year budget as well. In regards to where we stand with the Independent Living Fund, Chair, I'm sure Mark or some of the other officials can pick up in more detail at a later stage, if that would be suitable to you.
Yeah. Are you okay? We'll come back for some more detail on that, David. Do you have anything, a follow-up or?
Another question, maybe?
Yeah, go ahead, David.
Minister, can you hear me clearly now? I'm just checking.
Take your mask off.
No. Can you hear me clearly now? Just to.
David, I actually think it's my connection rather than anything from that side as well. So if you keep going,
No
will
problem.
work.
Sadly, it appears that some domiciliary care providers, private domiciliary care providers, are leaving disabled people that they have contracted to deliver services to, absolutely adrift and alone, contacting the trusts, contacting the trusts and cancelling packages they themselves chose. The results are an added burden to the trusts and uncertainty and fear for the disabled people concerned, with the only option on offer going into a nursing home. In November last year, as you said earlier, you allocated an additional 23 million, intended to help such private providers increase their workforce and improve their practices. Given the current climate and this allocation of additional funding, can the Department and Trusts act to ensure private domiciliary care providers do not drop packages and people, at least until alternatives in the community have been identified and secured?
David, in regards to the additionality that we provided, part of our concern back in November and December last year was actually the high number of packages that independent providers were actually indicating they were going to have to hand back because of staff shortages and staff pressures. And that was where I suppose part of the major concern was coming to us as a department, but also the trusts, who were then feeling, and rightly so, were obliged that they were going to have to pick up those packages as well, where they didn't have the capacity either. When we introduced the additional 23 million to support the independent sector in regards to, as I spoke about, the ability for them to increase wages, terms and conditions, but also career progression as well, we saw a significant downturn in those packages that were going to be returned or actually stood down. So we did see a stabilisation of what the independent sector were able to provide. So we didn't see the mass continuation of return of domiciliary care packages that could have happened had we not intervened in November with that additionality of money as well. We're still aware of some challenges as well, and that's why we're compensating with the additional capacity within our trust to make sure that we are getting those packages for those individuals. But as I said in my opening comments, David, demand currently outstrips the supply that we have in regards to complete domiciliary cover, that what we want to provide as well. And that's why, the pilot that we have running in the South Eastern Trust, I think, really sets a model for what domiciliary care could look like in the future, because we know it has to change. We know the demands of the number of packages that we have, the people who want to stay in their own homes receiving the support, as you spoke about earlier, in regards to that through domiciliary care package or independent living fund or personal assistant payments. It's all important that we make sure that we're providing a system that suits the needs of the person rather than suits the needs of the system.
I think, if I may, I think that's part of the difficulty, because it's meeting the system's needs and the private providers' needs. It's also why I'm concerned about the ILF and indeed direct payments, but the ILF in particular, because the Independent Living Fund has seen an awful lot of people safe through the pandemic, because people were able to close their doors, stop domiciliary workers coming in who maybe had more chance of passing COVID on, and look after their own and have a level of money to fund PAs to do so. I think it's essential for future-proofing that we have that available to the most disabled people in this society, because it is the most disabled people that are affected by this. And we need to work assiduously, if I may say, yourself and future ministers, to try and get this through. It would be nice to see a consultation come out on the Independent Living Fund before the end of this term. I trust we can maybe try and work towards that. Thank you.
Okay, thank you, David. And I'll move on then to Amanda. And if I could just ask everyone, all attendees, that we have someone with visual impairment, so I'd ask the speakers clearly identify who they are before speaking and before answering. So Amanda, go ahead, please.
Hi, June. It's Amanda. Just let me.
Thank you, Amanda.
Okay. Minister, one of the issues prior to the pandemic, and even more so currently, is getting a timely appointment to see a GP. Perhaps a way to overcome this problem, and I'm just setting this as a little seed, would be for GPs to be paid in a completely different way. At the moment, they're paid per patient that they have on their books, whether they see them or not. Would it not be an idea to actually pay them per appointment? Then appointments would come flowing in, I believe. Okay. I'd like to ask what plans are afoot to work in co-production with disabled people to address the issues that we have with primary care. And can you advise me when GPs will open their practices to enable appointments to be booked? GPs were the first ones to close their doors, and it seems like they're going to be the last ones to reopen if they ever do.
Thank you. Amanda. Minister, please.
Thanks, June. Garog Cassidy, my Director of Primary Care, is on here. He'll be able to get into greater detail in regards to the specifics of GPs. June, I think you've just suggested this morning a complete rehaul of our National Health Service and how we operate with our GPs. So I'm not sure I'll be able to get that done by the end of this mandate. But I know it's something that has been long looked at, and when I look back, and people, when they know my politics, when I look at the National Health Service that Nye Bevan wanted to create back in the 40s, it was the complete system. GPs at that point weren't brought into the system as fully as they could have been in the National Health Service, but I know there are conversations happening in other places about how that greater integration works. June, in regards to your comments about...
Sorry, Minister, there's a little bit just of confusion there. It's Amanda, actually, that was asking...
Amanda, sorry,
yeah. Okay.
Apologies. It was you confused me at the start, Chair, but that's all.
Blame the Chair. Blame the Chair, Minister.
Don't worry, Chair, I will, because she usually blames me. Sorry, apologies, Amanda. Look, in regards to the challenges that we've had with the accessibility to GPs, sometimes I think criticism that is levelled to them is unfair. Our GPs are actually supporting an increased number of referrals to what they were previously, even previous pandemic as well. Our GPs are open. They are doing things differently in some cases. But even talking to our GP representatives bodies, they're not all they're all being tarred with the same brush, unfortunately. And I've visited a number of GPs who have went far and beyond in regards to what they're actually doing to open up their services and making sure they're fully accessible to the people who need them. We invested significantly towards the end of last year in regards to our GP services to make sure they could be more accessible in regards to telephone triage and enabling people to actually get in contact with them directly. Our GP services need more investment, both in regards to financial input, but also how they can be modernised as well, and that's why our multidisciplinary team approach, which was started, is important that we get the continued funding to be able to do that. Funding not just from a workforce capacity point of view, where we can bring in those physiotherapists, pharmacists, social workers actually into GP practice, but also the capital expenditure they need as well to increase the physical footprint that they need to see that wider scope of patients and provide that greater service as well. So there's a lot of work to be done again in our GP models. Our GPs are up for it. But as in regards to how we actually do that, we've also looked about increasing the number of GPs and GP training places. We've increased that significantly over the past number of years, but like the other challenges that we've seen in workforce, it takes time for those numbers actually to get through and those individuals to get through their training. So in the medical school that was opened last year in Magee, we'll see more practitioners coming out, hopefully more GPs under the practice as well. And as I said in my opening comments, we've increased the number of GP trainees by over 70% from our 2015 levels. Those changes don't result straight away in more appointments, more accessibility, but it's about investing now to redirect some of the underinvestment that we've seen over previous years.
Thank you.
Chair, I'm getting tight in time here, so I know you have a couple of other questions just to get in before.
Yeah. So I'll go then to June. June, go ahead there with your question, please.
Thank you, Chair, and thank you, Minister, for giving us the time. Many disabled people still feel unsafe. They are still taking steps to protecting themselves from COVID. They make choices if and when they go out, but what about them feeling safe in their own homes? Last week, I had 2 callers in the same day. One was a telephone engineer and the other was someone to read my electric meter. Neither were wearing masks, face coverings. I couldn't see, but I did ask. Right. I guess that with public health with measures that are currently in place to protect what currently are in place to protect people in their own homes and these situations. When utility workers, engineers, housing executive staff, trust staff, and in some cases domiciliary care staff think that COVID is over and they don't need masks or PPE. And what is appropriate PPE in these circumstances and in homes when they know that someone is clinically extremely vulnerable? Thank you.
Thank you, June.
Thanks, June. Just consider you read out a list of individuals, June, and I think you mentioned domiciliary care workers not wearing PPE.
Yes.
I'd be keen if you could offline maybe pass either through some of the committee clerks as well to get back to my officials so we can address that. Domiciliary care workers should be fully aware of their PPE requirements if they're providing a service to someone in their own home as well. I'll not go into the individual details if you don't mind just on this call, but it's something that I'd be keen to follow up on because we have protocols that they are required to form as well. In regards to those other utility users coming into someone's home who is clinically extremely vulnerable, they should be wearing face coverings and I suppose the utility regulator, if they have employees who have certain conditions or requirements where they can't do that, should be making those who can utilise full PPE and wear face coverings accessible for those homes that have CEV residents possible. There's a register out there, and I'm sure you're aware, for anyone who is clinically extremely vulnerable or requires additional acknowledgement for the use of electricity services and things like that would be flagged. But it's something, June, to be perfect in regards to other utility regulators. It's not something that has been raised with me before now, but certainly something that I'll get officials to follow up on after this meeting, or you can have a wider conversation with those still on the call after, unfortunately, I have to leave.
Thank you. Thank you for that, Minister.
Okay. Can
I have I time to do a second question?
Briefly, please, June. Yeah, go ahead.
Okay. Disabled people are still experiencing frustration about missing important appointments, medical appointments, as appointments letters are usually sent out and information sent out in paper form. Now, it's not only myself with visual impairment that can't read these, and in fact, during COVID, it has exacerbated the situation because I had 6 weeks before I could get a load of correspondence read, as I wasn't in contact with anybody. But for some of my other colleagues and friends and older people, they cannot hold paper sheets or find it difficult to hold paper sheets and so forth. So what can be done? What can be done that we can have accessible information to those who need it in this day and age of technology?
Thanks, June. In regards to how we actually change, how we identify patients coming forward, we did see some changes in regards to the utilisation of technology, especially in regards to bringing patients forward at short notice during the pandemic when we were seeing no slots or appointments become available. But the further use of technology to communicate with people with a disability or with a further need, that paper correspondence isn't accessible is something that, again, I would ask officials to follow up on, and just in our interaction with our engagement groups that we already have as well, about what work can be done across trusts. You may be aware, we're talking about introducing a new IT system across the entirety of health and social care and Compass, and it's about how it can be greater utilised, actually about how people access their records or appointments as well. If there's something there that could maybe be looked at even at this stage, because we want to make sure there is an ability that we're not losing slots within the health service because we've sent out a letter that isn't accessible to the person that we want to actually come in and access our health service as well. So I'm just trying to work through where we can actually best place that, but I'm sure Mark will be able to follow up with some of the officials later on. I know that in Belfast Trust, the cited guide service is one of the outcomes of the pilot project that the Belfast Trust actually involved in every customer counts, and that was an initiative of the Equality Commission for Northern Ireland. So I know that's operational in one of our trusts, is how we just make sure it's rolled out across not just the rest of our trust but also primary care provision as well.
Thank you. I guess I get very upset when I have to ask my family or someone to read a very personal correspondence letter. And I know that people are having appointments that arrive after the date of the actual appointment, and are missing them as well. So that.
Okay, thank you, June. And Michaela?
Good afternoon, sorry, good morning. I'm way ahead of myself. Good morning, everyone. Thanks, Minister, for taking the time to spend with us. Just following on very briefly from what June said, I would appreciate if I could also reach out on the PPE requirements for personal assistance, because that's not very clear at the moment, and it's certainly a question I have had asked of me. But many people, disabled people, rely on the services provided by our health service, and even when we are inpatients, we require the help of PAs, carers, or family members. But we're experiencing barriers to this. For example, we're experiencing people saying that we're not insured to use ward equipment. So this is in an environment where we're meant to feel safe, and it's making us feel unsafe and putting us at risk. So what is the department going to do to resolve those issues to make sure that disabled people are experiencing the appropriate continuity of care and that they are actually safe in hospital?
Thanks, Michaela, and I think that goes down to the crux of how we make sure our services are actually supporting the individual in regards to what they need when they need it, and how that service is actually delivered to them. That it is person-centred, as I said to David earlier on, that is how we make sure we're delivering for the people rather than actually looking after how the service itself works as well. In regards to challenges around about not being insured to use personal equipment, again, Michaela, I'll get officials to follow up if there's individual cases that you have in regards to that, because I know it does cause certain difficulties, but it's usually can be solved or rectified either due to training or additional enhanced support for those service users coming in. And part of the problem is when we get staff turnover in regards to somebody coming in to support a patient or an individual that maybe haven't received the appropriate training, or because of staff shortages at short notice have been asked to fill a slot or cover a service that they haven't received that training for. But again, we'll get one of the officials either to follow up in this session or to follow up with you directly after it.
Yeah, I would be more than happy to do that, Minister. It's an important issue. I have another question, if that's okay, if you've got time.
Briefly, please, Michaela. Thank you. Yeah.
Yep. So, I mean, none of our main hospitals in Northern Ireland have an outpatient changing places toilet. That includes the Royal, there's none in the newly built down, and there's none, as far as I'm aware, in the Ulster Hospital. So, changing places will be mandatory in certain public buildings in Northern Ireland, with building regulations set to change in June. So, will the department commit to having changing places toilets in all outpatient compartments in Northern Ireland?
Michaela, fully aware, of the announcement that Minister Murphy made in regards to that at the start of the week, but can also say fully aware of your part in the campaign as well. So, in regards to achieving that, I hope I have enough of a capital budget to build new hospitals in the future as well. But it's also how we look to make sure that all our facilities are suitable for everyone who needs to use them. So it is about how we progress any of those capital builds, rechanges in regards to changing places and making sure those facilities are accessible, but also being able to be utilised by everyone as well. So it's something that we're fully aware of through the campaign, and that has been done up until now, but also due to the change in building regulations, that it is something that will be required in any new build going forward as well.
Thank you. And then in terms of, finally, from the Disabled People's Parliament delegates, Joanne.
My first question is, many of the measures and supports introduced during COVID, such as testing, were not designed to be accessible to disabled people. Going forward, what will be implemented by the Department to ensure that lessons are learned to address, foresee and correct such end-user accessibility issues?
Thanks, Joanne. And again, a very important point. And I suppose when we looked at testing, especially at the start, was about mass testing and how we got it rolled out. And that is one of the learnings that we have to take as well on board. And there's the point that you make, to make sure when we do look at those facilities for testing, they're accessible to everyone, and not just in regards to how the tests are carried out, but where they're carried out. And by whom as well. So it's actually, rather than self-testing was a very effective measure that we brought in, but it's not accessible to everyone. So it's how we actually set up a supported service then as well, should it be necessary going into the future in regards to where we have, I suppose, COVID or other variants or outbreaks. I hope, Joanne, we're at a point where it is about looking for lessons learned for a future, and not something that we have to introduce in the shorter medium term as well, because I do hope that we're fully progressing out of this part of the pandemic as well. So your point in regards to making sure not just is testing accessible, but also the work that we have to do to make sure vaccination and those other support measures are accessible to everyone as well. So.
Okay, thank you, Minister. And Joanne, do you have a second question, Joanne?
Yes, the Office of National Statistics from Great Britain provided better data regarding the impact of COVID on disabled people. What steps are being taken to ensure the Northern Ireland Statistics and Research Agency replicate data sets in future to improve data collection and analysis regarding disability and disabled people in all future research to enable comparative studies and statistics, furthermore ensuring that disabled people disability no longer gets easily disregarded as a research limitation?
Thank you, Joanne. Minister.
Thanks, Joanne. You're not leaving me to finish with the easy questions, are you? No. Look, in regards to, and I suppose, no, the point you make in regards to ONS, Northern Ireland feeds into the ONS statistics as well, but our own statistical research here in the Northern Ireland NISRA statistics that we produce as well. And again, we're fortunate they actually sit under the Department of Finance. So when they take our health statistics and the figures they provide that, I suppose, arm's length analysis of the data that we're able to provide. I think one of the things coming out of COVID that we've seen is actually the importance of health data and the utilisation of that to make decisions as well. So that's why what we see coming out of NISRA, coming out of ONS, has actually been utilised to enable us to make decisions in certain ways as well. And when you look, the quality and the detail of the dashboards in regards to data that we've produced specifically in regards to COVID over the past 2 years, I think have been highly informative, not just for us as a health department, but also to be able to utilise by the general public as well. Again, I mentioned earlier Encompass, which is our new digital programme that we hope to roll out across all health and social care. Now, it will take a couple of years to achieve that, but one of the main aims behind that is to be able to look to the data that it'll be able to provide to allow us to drill down into regards to population needs, health needs, or the ability for early interventions as well. So it's really about how data captured is utilised to improve health outcomes, not just for individuals, but also for society in general as well. But always one thing that I've been conscious of and very clear on in the past 2 years, when we talk about data-driven decisions or driving interventions as well, it's crucial that we don't turn everything into data and numbers. What the health service is good at and what the health service must always be about is looking after an individual. For the individual should always be at the centre of everything we do. The individual should be always at the centre of every decision that we make as well. So while data is important to look to those bigger, I suppose, society drives or society changes, it's always important that we ensure we have a service that delivers for the individual and for the person.
Yes, I 100% agree, but it's just in future, if there is a data set that informs policy in a disability way, why isn't that being implemented in Northern Ireland in the same way?
And I think it is, Joanne, we don't have the systems in place to collect the data that we need to be able to make those informed situations at present. But one of the things that Encompass will allow us to look at that proactively, so we can make those changes as well. England introduced NHSX a number of years ago, so they are ahead of us in that. But it's work that is ongoing here, and I think it's work that will be valuable for us.
Yes, because qualitative data also tells personal lived experience stories through research. So research can tell person-centered stories as well as statistics.
Very much so.
Absolutely correct, Joanne. And actually, I think it's really a fundamental issue, and it's in terms of the minister's contribution, I think it's a great place to end. I do think COVID has kind of demonstrated the fact that we need better research, better data here, based locally, and just not extrapolated. And just to inform everyone in the meeting that we actually are taking a briefing from Encompass in our next session, and also in reference to the issue raised about GPs, we're hearing from GPs next week. So both of the issues you have raised are on the committee's radar as well. I just want to go back to you, Minister, to check. Thank you for taking those questions and for giving your presentation. And just to check, do you want to make any final closing remarks there before we go over to the other members?
No, Chair. Again, just to thank you for facilitating this session this morning, and to thank the people from the Parliament for attending as well. And and their questions as well. I'll not make any comments about the quality of their questions compared to the quality of the Health Committee's members' questions at this point, Chair, but I found the members of the Parliament's engagement very, very useful and very instructive. The only thing that concerns me now, Chair, is with that round of question, I have a raft of officials on here who have probably nothing left to answer, but I hope between yourselves in the Parliament, but also the members of the committee, that you still have enough questions left for them to make it worth their while being here.
Yeah, well, and certainly I think there will be other questions. But thank you, Minister, and I wish you all the best in the time ahead as well. And we'll certainly take on board the fact that you want the questions to be coming at you more hard and fast. And we look forward to seeing you at our next session. So thank you, Minister. And so I'm going to go now, and I'll take a round of questions from committee members, and then what I want to do is come back and leave some space at the end to come back to members of the Disabled People's Parliament, to pick up on issues and to follow up on anything that you feel needs a further follow-up. Can I remind particularly the members of our panel who are now coming in to answer questions, could you please identify your name so that people who are watching in, and I believe there are many people out there, I'm delighted that there are many people out there watching in online, as well as the people in the room. So for anyone with visual impairment, that you identify who is speaking, so to assist those people in examining the evidence. The other thing is that I want to say to the panel is, if you're picking up on an issue that was raised that the Minister indicated, please indicate that, and if you're picking that up as part of another member's questions. But for now, I'm going to go to Paula, and then I have I'm going to go to Colin first, then Paula, then Carol. Go ahead, Colin.
Thank you very much for that, Chair. Colin McGrath here, one of the committee members for the Health Committee, and it's been a great session to watch this because quite often we represent people's views, but whenever people can actually give their real living examples of what they are living with day and daily and the problems that they face, there is just so much more currency to that, and I know that certainly the Minister has highlighted that, so I hope that the officials will also likewise take away what you have heard today and work on responses. But there's just two issues that I wanted to ask, and I'll ask them in one go. One is in relation to the fact that we do have a cost of living crisis that everybody in our community is feeling, but those that have disabilities often have to have additional aids and adaptations and machinery, which costs extra money. Some people living with disabilities will require additional heating, etc. And I was just wondering what the department was doing to try and identify that and work with other colleagues to try and address that. And also in terms of those that are employers, as people directly employing people to assist them as personal assistants, there is a complete lack of support from the department in terms of being at the end of the phone if there are issues that need to be assisted with. And I was just wondering what the officials' views would be on that. Thank you, Chair.
Thank you. So, Mark, could you identify who's going to pick up the question, or a member of the panel identify who's picking it up and who they are, please? Thank you. Mark, you're on mute, we believe. Still not hearing from you, Mark, so maybe if another member of the panel could indicate to come in on that question. No, we're still not hearing you, Mark. So, do we have another member of the department panel who can pick up on Colin's question in relation to cost of living and in relation to PAs?
Chair, Gerard Cassidy here. I'm the Director of Primary Care. It's not really an area that I'm expert in, and I'm not really best placed to answer the question. But I mean, I'm very happy to take it back offline and come back with a proper response. In the interest of keeping the meeting going, I mean, I know when we're having some connection difficulties, you couldn't hear me speaking earlier, unfortunately. So unless Mark can be heard now, I'm happy to take that question offline and come back to the committee in writing, if that's okay.
Okay, well, I'll just check. We still don't have your sound, Mark, so that could be an issue. So what I'll do, Colin, is I'll move on to the next questioner, and we'll come back to that, and we'll either get that information back for you in writing, or we will, if we get Mark online, maybe he can pick up on it. But I'm going to go now to Paula.
Thank you, Chair. My name is Paula Bradshaw Lyons, Party Representative on the Health Committee. I'm very concerned about the rate of the reform and transformation agenda within the Department of Health, and I know it's a massive issue, especially during the COVID process, COVID pandemic. And I'm just wondering, what big reform packages is the department thinking of to look at the services that are in place to support those people living with disabilities?
Yeah, so can the member of the panel indicate picking up on that, on transformation?
Again, thanks, Chair Gerard Cassidy, Director of Primary Care. I can answer from the primary care point of view. And as you alluded to, I'll be back next week to talk about primary care access as well. So, if I don't cover it in full now, you can get a second bite next week. Prior to my working in primary care, I actually worked in transmission program as well. So I do have a kind of a degree of familiarity with it. In primary care, our single biggest, project or priority would be the multidisciplinary team program. It's the flagship primary care intervention. We've been rolling it out in earnest since 2018, and in terms of specifically for disabled people, the aim of the program is really to boost access for everyone, and that will include and benefit the disabled community as well. Being able to provide more services closer to home, avoiding need for onward referral into secondary care services, which are, as everyone understands, very stretched. Those are kind of key aims for us. Program has been it's been on the ground since 2018. We're currently we're taking a kind of a federation by federation approach to the program. There's 17 GP federations in Northern Ireland. We currently have a presence in 7 of those 17 to a greater or lesser extent. I would say it's fair to say that the COVID pandemic has had a significant impact on our ability to roll out. We effectively had to, through redirection of resources in health service and also kind of within the department and in the board as well, just kind of priorities focusing on addressing those issues. We have had as progress has been slower than we would ideally have liked. That said, we have a good level of coverage and a good level of service across those areas where we have it. The priority is to come up with plans for how to roll it out more widely. We've been working on a roadmap for that. So the first kind of product of that is an outline running order for where we will go next. That's been agreed, and the next challenge is to really get a kind of detailed plans in place for how it will be rolled out in those remaining areas, and at the timescale for that. Cognizant of the fact that we are in a very uncertain budgetary position, and there also are significant workforce pressures, which will determine how we do that. Key to our approach in doing that is working in partnership. That's working in partnership on a local level with federations and trusts, and also with our professional colleagues to see what scope we have for creativity and for innovation in our approach, and also what would be to maximise what is deliverable in those areas within the kind of financial envelope and within the kind of the constraints of resource. I don't know. That's probably quite a narrow answer to your question, Paula. But if you've I can take any more further questions on that at all.
No, thank you. I suppose in some ways I don't think it was specific enough to those people living with disability, and certainly towards the end of your response there, it looked like you were consulting, sort of within the federations or within the department, and I'm just wondering in what way you would be engaging going forward in terms of a specific package of transformation measures that would actually meet the needs. Certainly some have been outlined today, and I'm sure there's a long list as well. What is going to be done specifically in terms of co-production with those people living with disabilities? I'm not sure you can answer that today, but it is something that
Well,
I think needs to be addressed.
I mean, I can answer as far as I can answer, Paul, and that's picking up on one of the Disabled People's Parliament. Amanda raised a similar point as well, so it was something I was kind of keen to come back on. Co-production, I mean, as you'll be aware, goes through the heart of the overall transformation agenda. We primarily, I suppose, we look to work through the Patient Client Council as a kind of conduit to engaging with particular stakeholder and patient groups. But I'd be very open to working with the Parliament as well. I mean, you know, to kind of to provide briefings and take their views and work with them on how we can better reach disabled people and reflect their needs and their interests and concerns in as we can make plans for development.
Yep, thank you, Gerard. Thank you, Paula. I'm going then to Carol. Yeah, go ahead, Carol.
Thank you, Gurmagad Caherly. Carol Killen, Sinn Féin MLA for North Belfast, and I'm also sitting on the Health Committee. So thank you for being here with us today as part of our questioning to the Minister and the officials. I'm not sure if Mark is back on, and I appreciate that everything that's been said up until now is probably the right thing to say, but in the middle of it all we have a crisis in workforce, and unless that crisis is addressed, that the questions that were asked, every single one of them are completely valid, then how can we have better access to respite? How can we have better access to multidisciplinary teams? How can we ensure that GPs are more open and accessible? So that would be the main thrust of my question, Chair.
Yep. So on workforce issue, can I ask someone on the panel? I don't see Mark online there, so I'll ask someone else on the panel to pick up on the issue of workforce and its impact on developing and delivering services.
Chair, if I can just come in briefly. This is Ryan Wilson. I'm Director of Secondary Care in the Department of Health. Mark is unfortunately having some technical problems, so he has joined me in my room here, so he will have missed most of Carol's question, but if you wouldn't mind, I think if I can just summarise it, the question is around workforce issues and how they might be addressed. Carol, I'm sorry if I haven't captured that fully, but would you mind summarising just for Mark as he's now?
Brian, I'll ask Carol to repeat the question. Carol, go ahead and repeat the question, please, just for clarity.
Mark, it's good to see you. We've all had technical problems, so what we usually do in here is what you've just done. We scoot into each other's rooms to make sure we don't miss anything. So to make sure you've heard all the questions, I'm going to repeat it again. Most of the questions that everyone has asked up until now, at the heart of it all, in my opinion, is a crisis in workforce. So, for example, around co-production, around access to GPs, around domiciliary care packages and access to respite care. In the middle of it all, there is a crisis in workforce and workforce planning. So what can be done to ensure that that is addressed as a matter of urgency? And if you don't mind, if you could speak up a wee bit, because I'm having difficulty just hearing, and maybe it's just technology, but I'm having difficulty hearing. So, please.
Thank you.
Thank you, Carol. Mark McGugan, Director of Disability and Older People, and apologies, Chair, I've had a nightmare with technology this morning, so
yeah.
As I am with Ryan. In terms of workforce, my primary area would be in relation to domiciliary care and care homes workforce and what we do in terms of trying to bolster the independent sector. As Minister noted earlier, we did put significant additional resource into the sector in November. That's primarily stabilised the sector and has attracted new people into a number of the major firms. We are also delivering what we call a Fair Work Forum, which is a co-produced piece between ourselves, the department, a number of the regulatory bodies, the unions, and a number of the domiciliary care and care home providers. This is in terms of trying to set a fair standard across the board. We will be appointing an independent chair to take this work forward, and this work will dovetail with the consultation on the reform of adult social care. So we are trying to do a number of things, Carol, to ensure that the workforce is there. In terms of respite services, the Minister did mention around the PHA pathway, which he has now approved, We're working with trusts, and we have written out the trust to ensure that they do reopen respite and daycare services as quickly and as safely as is possible. We have responses in from all trusts now in terms of the rebuild plans, and we're analysing those and challenging the timescales and challenging the work that needs done to reopen the respite services and daycare opportunities. But you're right, staffing is a huge issue. The ongoing long COVID and the impact of Omicron has had on services has meant that some services in the community have had to be stood down or reduced to tackle some of the pressures in the acute services. So it's a situation which we're trying to tackle. In terms of other workforce issues, I will pass on maybe to Ryan or Garrod to deal with those.
Thanks, Mark. There's just one point I think worth adding to that. Members of the committee at least will be aware of the department having published a workforce strategy a number of years ago. And I think Carol quite rightly points out that most of the pressures do boil down to a workforce or a need to train and recruit more people and right across specialties and across primary, community and hospital services. So I think the point needs to be made that a lot of that depends on investment and had been factored into our plans for a 3-year budget. So we really need some progress on the future investment and the future budget in order to be able to begin to really meet the root cause of some of those workforce shortages, in addition to the issues that Mark has mentioned around sickness and turnover.
Yeah, and Garrod, were you going to come in there briefly if you can?
Yeah, Chair, thank you. Just to add, and kind of the Minister has alluded to this already, I mean, we're keenly aware of the workforce challenges in primary care, in particular around the number of GPs. We've done a lot in recent years to increase the number of GPs. I think Minister referenced there's been a 70% increase in the number of trainees over 2015 levels. So it brings up to 111 trainees on an annual basis. We're just embarking, or have recently embarked on some work to review the number of GP training places that's required to make sure that we do have the right numbers going forward. I mean, that work is not yet complete, but that will give us a very strong sense of what we need. And as Ryan's indicated, what we can deliver on that will be subject to the budget and kind of wider funding position.
Yes, Chair, can I just have a small follow-up question? Look, I appreciate we're all in a situation that's not of our making. We don't have an executive because the DUP walked off the stage. We can't go beyond budgets because we need to live from budgets from week to week. So we know all that, but the issue is, and no one's answered it, and I'm not being awkward, but the talk about the importance of MDTs has been talked about and won't be addressed until we tackle the workforce issues. And if the MDTs aren't addressed, and all the services that are needed won't be addressed either, it'll be piecemeal and it'll be by postcode. So I just want to put that. The last question I have, Chair, is this. Has the £500 payment for recognition been paid to everyone in the independent sector? If we could get that confirmed, because that is still something each of us are getting raised in our constituencies. Sinead,
Carol. Agus Arish, Gojian panel. Could someone pick up on that question around the £500 payment on independent sector, please?
Yes, Chair, Mark McGugan again here. I can confirm that the £500 payment is being actively rolled out as we speak. There's been a number of elements to this, and that we're currently working on now for people who have left employers during the qualifying period. So we've written out to employers to ask them to make contact with previous employees to ensure that we can pay that to those employers or those employees. We're rolling that out at the minute. The next stage of this then will be launched on the 21st of March, which will be in terms of payments to personal assistants, Independent Living Fund and survivors of thalidomide fund. So that will be launched. We're using a portal through the college in ILF Scotland to manage those payments directly. So it is rolling through. We've progressed this significantly. We have had a few hurdles along the way, if I'm honest with you, Carol, but we're working very, very hard to make sure this is rolled forward. We've been able to move the money into next year to allow us to continue on with that. So we're working through all of the cohorts, but we are trying to make sure that everybody is covered in this payment that is eligible for it. So that work continues, and we are still putting significant resource into getting that through as quickly as we possibly can. But it is rolling forward.
Thank you, Mark. And I think David wants to come in briefly on this one.
Yep. David McDonald, Disabled People's Parliament. Mark, I just want to, you were talking about domiciliary care providers there. I'm wondering what the situation is with PAs, particularly on the direct payments. We have not seen any money increased. So for 3 months, as direct payment users, we've been sitting on the same amount of money we had before Christmas, which in itself came along late. So how on earth do we compete? How do we stop our workers leaving and going to try and get more money from providers, and therefore creating another crisis amongst disabled people who are, quite frankly, freely and without any charge trying to look after ourselves?
Yeah, so follow up there, Mark, in relation to the PAs.
Yes,
500.
Chair. In terms of PAs, we are working with trusts to gather the data on how much we pay out in terms of PAs and how much that would cost them to give an uplift to PAs. As David is aware, we uplifted the domiciliary care hourly rate to £18 an hour to those providers who are delivering domiciliary care. My understanding is that the rate for personal assistance at the minute is in around £13.50 mark per hour, and that is paid directly to the individuals. We are, as I said, we're working on trusts to get the data. There's a significant amount of money paid out by trusts in terms of personal assistance, and this will sound like a broken record, but as we go into next year, the financial position is very, very difficult. We will be putting advice to the Minister as soon as we possibly can in terms of what it will cost both this year and going forward next year, and seeing what is deliverable about that. But that is something which we're actively considering, and I totally take on board David's comments that it is very difficult, and we are getting a lot of correspondence on the fact that people who are employed through direct payments are starting to leave to take up employment at a higher rate with domiciliary care firms, and we are really alive to that. And I can only apologise that we haven't been able to progress this quicker than we have at the minute, but it is something which we're actively considering, and we'll be putting advice to the Minister as soon as we have an appropriate figure work in place to do that.
Did you say £13.50?
I think I have a figure, £13.58, David.
In the reform of adult social care, the differential is between £18 for private providers and £15 for direct payment users. Why are we keeping it so low when the providers are getting $18?
Sorry, I had a figure in my head of £13.58. I've ran in another office and I haven't lifted my folder, if I'm honest with you. So I will come back to you on that, David, if that's okay.
I'm simply saying it should be equitable. So if you're paying private providers an extra, £3 is what it would be, from £15 up to 18 odds. Direct payment users should get getting the £3 too.
Well, I think we do have to look at what overheads, etc., major providers would have in delivering that service across the board, compared to what somebody employed in a direct payment would have. You would suggest we should have an equitable rate of £18 an hour. We have to see if that is affordable, and what we can do to make sure that we do not allow people to leave direct award contracts or direct payment facilities to go into domiciliary care. So we are looking at it, David, and we're actively looking at it.
Some providers are currently offering, the most I've seen is £15 an hour. Generally I'm seeing £12.60. How can I possibly do that on £13.50 when you take into account my contributions to national insurance, which is 13.8%, and will go up 1.25% come April? Also have to pay towards a pension. There's no way on £13.50 I can match what the domiciliary care providers are making, and they're doing it for a profit. I'm doing all the work for nothing. I don't charge for the work I do to provide management of the care, and I think we need to reconsider the £13.50 and look at maybe what was recommended in the adults, the reform of adult social care, which is £15. The care providers were offered £18, and they're getting £18.
Thank you, David. David, I have Michaela looking to come in on this issue as well, so I will bring Michaela in. The last members where we indulge it, just we'll go to Michaela because I think it's an important issue. Michaela, go ahead, please.
Yeah, sorry for that. Thanks very much, Gary. I appreciate it. I just want to ask the department when the last time that they actually assessed what the overheads are for individuals who employ personal assistants, the cost that would be, because as David says, we are doing this for free. And if they haven't done it, will they commit to doing it now?
Mark, please.
I can certainly commit that we will consider that, Michaela, as part of the outworkings of the Reform of Adult Social Care consultation. That the consultation will come to me to implement after the consultation responses have been analysed. So I'm more than happy to give that commitment that we will consider that as part of the wider Reform of Adult Social Care work going forward.
And okay, and I will move on, but just to indicate that we have raised in committee previously our disappointment at times with the lack of bids that have been put in by the department for additional pressures, and I think that's relevant to that discussion. So, Mark, there is some important information you've committed to providing back to the members of this meeting, and if we could ask that to be done urgently, just in the circumstances that we're in time-wise. Thank you. So I'm going to move on then. I'm going to go back to Colin, who lost his opportunity to ask Mark his question due to the technical difficulties. So Colin, I'll go back to you, please, as brief as you can.
Thanks very much indeed. I suppose maybe the members of the Disability Parliament that have joined us today will understand sometimes our frustration, Chair, because Mark, that was a great civil service answer, that you would commit to consider something as opposed to actually doing it, and that sometimes is the frustration that we have, and we've got to keep that check and keep that pressure, and that's the importance of having the likes of a health committee to keep those checks in place. But the questions I have, Mark, I'm sure you remember them. They were about the cost of living crisis that people are facing at the minute, and how that would be more severely felt by those from the disability community because of the additional costs that they have, and if the department has done anything on an interdepartmental basis to see if there's ways to resolve that. And then just following on from that conversation there about personal assistance, where people are actually the employers but they don't have any of that access to support in terms of employment rights and insurances and other bits and pieces, and is there something that could be done on that front as well? Thank you.
Yep.
Thanks, Colin. In terms of the cost of living crisis, I would suggest that's more an executive matter rather than directly a Department of Health matter, because obviously other departments are providing additional grants for heating and additional grants which are already being ruled out. So I'm not sure that the department would have the funding or the virus to actually deliver that directly. In terms of personal assistance, I do take on board there's been a number of questions raised today in terms of personal assistance, in terms of insurance, and in terms of the actual cost of delivering that service. So I am committed, and you're right, I take pride in being a good civil servant. So, but I will give a commitment that we will look at those issues directly, and we will come back to the committee as quickly as possible.
Okay, Colin.
Yeah, Chair, that's grand. I think we've lost the word consider there, so that's good. I appreciate that. Thank you very much, Mark.
Okay, thank you very much, Colin. And going then to our Deputy Chair, Pam Cameron. Go ahead, Pam Lanneray, Liddehall.
Thank you, Chair, and thank you to the panel for being here today. And I want to say particular thanks to our delegates from the Disabled People's Parliament. I think it's been a really powerful session this morning, and I think your questions are just fantastic and so relevant, and I think it's a great opportunity for you to challenge the Minister and the Department directly on the issues that affect you most. We understand that there are almost 1 in 5 people in Northern Ireland are living with a disability, so it is essential that disabled people and their advocates have a forum to make their voices heard. And we need to ensure that those living with disability are to the forefront of shaping new legislation and policy. And disabled people must also have a substantive role in health recovery. I am concerned, I suppose, about how we collect or don't collect data, and about how we consult or don't consult with interested parties, and how we plan, and ultimately how provision is rolled out. And I know the question was asked and around consultation. I think the answer was it's done through the patient-client council. Maybe you could confirm that's right, and that suggestion that there is an openness to possibly consult going forward with the Disabled People's Parliament. I think that would be entirely appropriate, and there may be other groups as well that could be included in that. So if you could just talk a bit more around that, and whether, obviously we will be getting the much awaited briefing on Encompass soon today, and what role will Encompass have in improving that data collection and gathering those data sets in order to plan going forward in terms of workforce issues.
Yeah, so we'll go back to yourself, Mark, maybe initially, or do you want to indicate another one of your officials?
No, I'm happy to take that, Chair. As the Minister noted in his opening comments, we have established a Regional Disabled People's Forum for Health and Social Care, and we do engage directly with the sector. Deputy Chair will also be aware of the Autism Forum, where we have a co-produced an Autism Forum where we have people with lived experience of autism on that forum in helping us deliver and shape policy. David also sits on the ILF working group, where we have developed proposals for ILF going forward. So, and indeed, each consultation will have its own set of specific stakeholders that we will engage with. So it's not a one-size-fits-all, but we do engage extensively with the disabled sector and other sectors as well. And the work today that the committee have done, I have to commend as the Director of Disability and all the people in the department. I do commend the work that the committee has done today, and it's an example that we will take forward, and we will try to engage more fully with the Disabled People's Parliament as we develop policies going forward. And that is a commitment; it's not a consideration. It is something which we will engage more fully with the Disabled People's Parliament as we move things forward in the reform of adult social care.
Okay. Pam.
Yes, thank you for that. And I wanted to also ask around access to GPs, and as other members have already mentioned, the rollout of MDTs, and in particular the concern there is around the rural areas within Northern Ireland. And I should have, Chair, earlier passed on Deborah's apologies for this meeting. She's has COVID and has been sick and not able to attend today. But I know she would have been very keen to ask around those MDTs, and she's very concerned, obviously, about the GP provision in the west of the province, and that sustainability going forward into the future. So what more work is being done to ensure that we will have the GPs there that we need? And we know, we've heard before from GPs, and we've heard now about how new GPs are working differently from the older generations of GPs, and that we really need to be real about this and understand that we need much more in terms of quantity and numbers of GPs, because part-time hours often equate to full-time hours in terms of GP services. And we also know that obviously females within those roles, throughout all of the health service actually, often have caring responsibilities throughout their lives, whether that's for their own children or caring for older members of the family later on in life. But there are circumstances in life which mean that people can't not always work full-time with their profession throughout their lifetime. And I think there has to be a realisation of that. So what plans and preparations are being put in place to ensure that we have the numbers, not just in GPs, but of all the different health professionals, that the numbers actually stack up to meet the needs of the future?
Yeah, and just before a member of the panel, could I remind the panel just to state who you are, so for those who are watching in on the meeting or attending the meeting who are of visual impairment, and also just to remind members that we are seeing a simultaneous British Sign Language interpretation, and we will be arranging for Irish Sign Language interpretation to be made available for those who wish to follow the meeting, to pick up on the meeting later. So I'll go back to the panel then in relation to the GP question. Is it yourself, Gearóid, and Wilson Tussa? No, Mark.
Thank you, Chair. No, I'll take this one. I'm Gearóid Cassidy, Director of Primary Care in the Department. And thank you, Pam, for the question. It was something I was keen to come back on. Amanda had asked questions in a similar point from the Disabled People's Parliament. There's quite a lot in the question. I mean, in terms of the GP practices and accessibility, I think there is the kind of, certainly Amanda's initial point was around GPs not offering appointments, I mean, I think it's probably more accurate to say that there has been a change in how appointments are being offered. The committee will have been briefed before, and I'm sure I'll be here next week as well. We can go into some more detail then, but there has been a move towards a telephone-first model for consultation. That really is a means of managing increasing demand for services. I mean, it predates COVID. I mean, COVID has accelerated the trend towards doing that, but strategically and operationally, that this has been the kind of intended direction for a while now. It has had through the pandemic, it has had the benefit of it's been able to make sure that services were able to remain open and accessible to people in a time when there was a limitation on the physical number of people who could come into practice due to IPC measures. The challenge is obviously for us to make sure that system works as well as it can work. I mean, I would say we've put in considerable investment over the past 2 years, 1.7 million in each of the last 2 years, specifically on improving the telephony systems, but also then improving the use of those systems to make sure that it's not just the telephone there, but there's someone there to answer the phone and to take action, be it for a repeat prescription or for an appointment. I think the first thing the GPs would say as well is that they do still offer face-to-face appointments where it's appropriate. It's just that there's a level of the consultation starts via the telephone. For the majority of people, it means that effectively.
Sorry, I'll have to interrupt you there and ask you to be as brief as possible. We are under pressure of time.
Specific. Well, no, so I mean, I can come back and talk in more detail about the access issue. In terms of the workforce issue, I've already mentioned we're doing a lot of work to understand what we need for GPs. I mean, and that is driven. Part of that is understanding what's driving. We've increased the numbers of GPs in training, but at the same time, the number of FTEs being worked has decreased in the same period. That's due to a kind of different lifestyle expectations and the realities of people's lives, as Pam has indicated. That work is being factored into our review of the requirements for training places. And finally, in terms of rurality and MBT, I mean, I'm very aware that rural practice in particular are under pressure. I met with Fermanagh and Omagh Council a month ago, and I'm due back in a couple of weeks' time with colleagues from the board to really talk to understand their issues and to help them understand what we're doing to help with that. MBT is a very important part of that, and as I've indicated, we are putting together, doing detailed work on how we can move forward in what is a very difficult financial and also personnel time. But I'll leave it at that for now, and I can come back on any more details next week.
Okay, if you could provide the committee with detailed information of the planning that's going on. Also, can you give us a date, Gerard, for when the roadmap will be published for MDT roadmap? What's the date? The roadmap, we've been finalising a version. The roadmap's been through several kind of. It's been a long gestation. Sorry, Gerard, I do want to apologise. I just don't have time to go into. I'm just looking to know a date if I can.
I'd say in the next couple of weeks.
Okay, thank you. That's useful. I'm going to go then to our.
I think just one of the members were looking to ask a question.
Well, I'm going to be coming back to the members. So I'll go to you early and I'll be coming back to the members. And I do want to, we are under pressure time, but I will come back to the members and ask Dave Dewey for another brief question or final comment or whatever. But I'll take our latest question and then come back to the Parliament delegates.
That's great. Thanks very much. And just first of all, a very warm welcome to all the members of the Disabled People's Parliament, I know virtually, and the guests that are in the room with us. I think the Minister was right. Your lines of questioning, you have definitely showed up the committee members today, so well done for that. And maybe just to follow on from one of the other questions that was raised by one of the members directly to the Minister, it might be for Mark. It was just in terms of the Independent Living Fund, and I know the Minister couldn't commit to funding that before the end of this mandate. But does any of the officials on the line have a detailed update as to where that is actually sitting within the department? I know the lobby that we received says that the proposals might be with the Permanent Secretary, and is there any chance or likelihood of even getting that proposal out for consultation before the end of the mandate? That's my question. And then just secondly, to make the point that I do want to welcome the investment that's recently came from the Department of Health from the Mental Health Support Fund. There was a pot of money that has went into disability action to help provide mental health supports for disabled people, and sometimes I think that's one of the big issues that can be sort of overseen and forgotten about. So I want to welcome that investment, and hopefully you might have a bit of a positive update in terms of the Independent Living Fund. Thank you.
Thank you. Go ahead, Mark, please.
Mark McGugan, Director of Disability and Older People. Yes, I can update that the submission in terms of next steps to the Independent Living Fund is currently with the Permanent Secretary. There's been a number of iterations on that, and as the Accounting Officer, the Permanent Secretary has come back and challenged a number of the consultation, or sorry, the proposals within the submission to him. At this stage, it'd be very difficult for either the Permanent Secretary or the Minister to commit to doing anything next year in the absence of a 3-year budget. And I know you keep hearing that, but that is the reality to it. The proposals that came forward from the ILF working group were to reopen the fund, which would have cost either 7 or 14 million, depending on what option was agreed on. At this minute in time, the department quite simply doesn't have that additional money to commit to new resource going forward next year or in following years. But I said that submission is with the Permanent Secretary at the minute. It went back to him this morning, actually. It says it's been backwards and forwards with the Permanent Secretary because he has challenged some of the workings in the submission and the proposals within the submission. So we hope to get that submission to the Minister, but I cannot give a commitment to go out to consultation on reopening the fund at this stage because we simply do not have the funding available to do that. But that will be a decision for the Minister to take on advice from the Permanent Secretary.
Okay, Mark, and thank you for that response. And just to say, I do think it would be helpful whenever those conversations have concluded with the Permanent Secretary and the Minister, if it is in fact a case of this can't be taken forward because of the lack of the 3-year budget and the lack of First Minister. I think that needs to be provided in writing to the Disabled People's Parliament because it's too important an issue.
Yep. Thank you, Aurelia.
Yep.
Go ahead, Mark.
I'm just saying I'm happy to commit that, Chair. We will get the Minister to write once the decision has been taken.
Okay, and I'm conscious we are, as always, under pressure of time, but there may be questions that haven't been asked. But if members of the meeting want to forward questions, we'll forward those on to the department and seek a response to those. So what I want to do then is, and I know I have an indication there from both Amanda and David, but what I want to do is take another brief question, and it will literally only be a minute or two now that we have each. If I could take a brief question or a comment from each of you, and what I'll do is I'll go in reverse order from what we did originally. So I'll go to Joanne, Michaela, June, Amanda and David. So back to Joanne then on screen. Joanne, do you have any comments or anything you want to follow up on very briefly there, please?
Thank the committee for the time today, and also to ensure the department plans to ensure that disabled people are meaningfully involved in shaping decisions of health and social care in the future, particularly in relation to the trust.
Absolutely. And I think that is the overarching lesson of the day, and why wouldn't they as well, in a routine, a regular, and just that is essential. It's in everyone's interest. I say this often. It's in the department's interest as well to take that expertise on board, rather than it's direct, it's very valid, and it's very accurate. So thank you, Joanne. Michaela.
Thank you. I just want to thank everyone involved in making today happen, and also for being so open to answering our questions. I do have one final one. I pressed the Minister earlier on committing to having change in places when it's available in all outpatient departments. But in terms of being an inpatient, very few hospital beds have overhead hoists. If you need to be able to be hoisted onto a CT scanner, that can be also very difficult. And there are other physical access problems, both as an inpatient and an outpatient. So I would like to ask the department to commit to investigating what those issues actually are and to addressing them.
Yep, Mark, do you want to pick up on that one?
I think, Chair, that would be a matter for us to take forward with trust. I would suggest that what is available within a hospital is a matter for the trust to deliver as opposed to the department. So, but I'm more than happy if the committee want to write to us, we will take that forward with the relevant trusts.
Okay, thank you. And going then to June. Go ahead, June, please.
Thank you for your time, everyone. And I just want to say that I want to go back to communication, because communication is key right across the whole of the health service, everyone and the trusts. And I'm just wondering, I know Minister answered my question well, but I just wonder how long we've got to wait for appropriate information to make sure that all patients have appropriate and accessible information, and also what are the departments and trusts doing to communicate with people whose first language is not English.
Yep, back to yourself, Mark. So go ahead, Mark.
Again, Chair, I'll come back with a detailed response on that. One of my colleagues, Colin Dunlop, who wasn't able to get on to it, dealt directly with that on my behalf. So if I can get back with a response to the committee on that, it would probably be more helpful than me trying to bluff them away, if I'm honest with you.
Okay, thank you, Mark, and we look forward to receiving that. Amanda.
Just two things actually. The first thing is, I hear time being bandied about as if a year, 2 years is tomorrow, but for a disabled person that may be their only tomorrow. Please keep in mind, we are talking about very severely disabled people here, and you talking about training GPs in 2 years' time may be too late for some of us. I've also a question that there's evidence in Great Britain of blanket DNR orders being used inappropriately with disabled people during COVID. Is there any similar data, again that word, or statistics that show how disabled people in Northern Ireland were treated during the pandemic? Why is it that we can choose a DNR, we can choose to die, but we cannot choose to live? The consultant has the final say.
Good for you.
Thank you, Amanda.
Well done, Amanda.
Thank you. And Mark?
Actually, Chair, I can come in on that one. Gerard Cassidy, Director of Primary Care.
Go ahead, Gerard. Thank you.
Yeah, Amanda, I'm sorry, thank you for the question. I mean decisions of CARDO CPR are best made as part of a holistic approach to advanced care planning. I'm aware of the case from England, and my understanding from that is that whilst there was the Care and Quality Commission in England published a report in March 2021, which highlighted a number of concerns in relation to DNS CPR. They found few examples of blanket policy, but they did recognise that in about a third of cases there was inadequate discussion with patients, and I think that kind of discussion and consultation is really important. You're probably aware we have out for consultation at the minute a policy in advanced care planning. That is looking to kind of really broaden the conversation around end of life care, around advanced care planning, and part of which is around the DNS CPR issue. It's any blanket approach to that would be unethical, and I don't have any evidence or any data to suggest that that has been the case in Northern Ireland.
Can I just say, from my point of view, I'm 57 years of age. I went into the chair when I was 50. I have never, up to the age of 50, been offered a DNR. So far, I've been offered it 7 times, minimum 7 times. There's something going on. It needs to be looked into.
Yeah, no, that's a crucial and a very well-made point, Amanda. Thank you, David.
David MacDonald, Disabled People's Parliament. Marcus, addressed to yourself and indeed to the department. I think the department might be in danger of being seen to put money out to private providers who are looking to make a profit, and ignoring how disabled people can help themselves. We don't just sit here and as groups meet with people, try and improve the lives of other disabled people and ourselves. We actually run our own services. We look after and employ PAs, be that with direct payments or be that with the Independent Living Fund. And I appreciate that money is tight, but I see no money going towards disabled people themselves to run their own staff. And I think the department needs to reflect on that, because when you do say you've no money, but 23 million is going to domiciliary care providers who make a profit, I think some of that money should be considered for disabled people who do not make a profit, who save the department money and who look after ourselves with a wee bit of help. Mark, thank you, and thank everybody, Chair, Deputy Chair, for this today. It's been well worthwhile.
Okay, listen, thank you, and I want to very sincerely thank everyone for what I think, and include the panel, include the Minister, and in particular the delegates from the Disabled Persons Parliament and those who are here with them today, their PAs, family members in the gallery, and you all. I think it has been a very important day, but more importantly than that, a very productive day. I'm not in the least bit surprised about that. I have witnessed your calibre, your capacity and your ability to influence decisions around your own care on your own behalf and on behalf of other people, so that's of no surprise to me at all. My principal wish coming from this meeting is that this will no longer be an unusual or an interesting day in that sense, that it's just routine and regular and happens. In respect of that, I do want to very sincerely welcome the commitment from the Minister and the officials that they will open up an ongoing engagement with the Disabled People's Parliament, and I think that's appropriate and welcome and will be useful for all concerned. I think it's been a huge benefit to have you with us today. I want to thank each and every one of you for your time, for your commitment, for your preparation, which was very clear, had been in place, and I think made this a very effective session. And again, that doesn't surprise me in the least. So, Goramila Mayagov, I wish you and all of the people who you represent here today the very best in what are difficult times, but I know that you are leading in terms of addressing the challenges that people with disability face. We must do much better. I didn't get a chance to ask any of the questions today, but I do have some I want to ask in relation to European social funds, in relation to UN CRPD and how that's going to be implemented, but I will pass those on to the department via the clerk. But listen, Goramila Mayagov, Big Islam, please take care. Thank you.
Well done. Well done.
And members, we're going to take a short pause there, and we will resume our meeting at 11:30. We'll resume our meeting at 11:30. Thank you.
Programme signed. This is the Northern Ireland Assembly.